Carilion Clinic's heart valve program is a multidisciplinary program that started probably about 2.5, 3 years ago now. We perform a pretty wide variety of procedures on valves. When we think about our therapies for heart valve disease, we look at the patient's risk profile and we decide whether or not a patient is appropriate for more conventional surgery or really is too high risk for surgery and needs some sort of percutaneous option, a minimally invasive option. We also certainly offer a breadth of surgical treatments.
It's truly a situation where each patient has to be individualized based on what is technically possible and what we think is the safest, least invasive, and most appropriate approach for each patient.
Patients can come in with a lot of symptoms and problems related to whatever their heart disease is. Once we correct that, we can really see dramatic improvements in what patients can do afterwards.
When patients find they have a problem, we bring them into our clinic. Our nurse coordinator works with them and their families very closely. There's a multidisciplinary approach with cardiologists, surgeons, and our nurse practitioners to educate and evaluate patients.
I think it gives the patient much more satisfaction. They know that they've had a thorough evaluation, not by just one physician, but by many physicians who are all skilled. Once we're able to treat patients in that fashion, I think it translates into lower risk of death, complications, quicker return to work, shorter hospital stay. So many, many benefits, not only in outcome, but patient satisfaction.
You know, heart surgery is a big deal and no one takes it lightly. I mean, typically patients, when they hear they have heart disease, it's a scary thing. There's a lot of emotion that goes through their minds. Many are fearful of the idea of surgery. So our job is to help them to understand what they have, what their options are, make sure that they're as best informed as they possibly can be.
A lot of our patients come through the clinic because they're fairly complicated folks. They have a lot of other medical problems besides just their valve disease, including aneurysmal disease, atrial fibrillation, other types of arrhythmias, other aortic disease, and all of these again play into the role of treatment decision.
Well, we've seen enormous changes in the last 5 years with the advent of catheter technology. I think that's only going to continue. I think it's going to become applicable to more patients, lower risk patients, and I think it's going to be a completely different landscape 10 years from now compared to what it is now. And that's only going to translate into better outcomes for patients and less invasive procedures.
By far and away, the number one thing that makes Carilion Clinic unique is the fact that we really do take this dedicated team approach to streamlining care. You don't come into the clinic wanting an opinion, wait another month, get another opinion, wait another month, get another opinion. We try to streamline this process so that folks really have an idea of what's going on and what needs to be done to take care of them within a matter of weeks.
We have a large volume practice that encompasses all of adult cardiac surgery. We monitor our quality outcomes very closely, and our volumes and quality numbers really are as good or better than any comparable programs in the area.
My advice to patients is really look at your options in your area. See who's available in terms of expertise and experience with treating valvular heart disease. You really want to go to a center that has high volume and a very strong team approach and that makes you feel comfortable when you enter the center.
We really have a team approach here, and we really try to keep the families involved heavily with our patients because they're really critical in the recovery process.
I like to tell families to be supportive. Generally, we get a great outcome and we restore patients to phenomenal functional levels.